Welcome to Dr. Momma Says. I'm your host, Dr. Deborah Burton, a board-certified pediatric ear, nose, and throat physician. Based on over 25 years of experience, I plan to share timeless tips about parenting and healthcare. Thanks so much for joining today. And now it's time to get on with the show. I did it. I finally launched my podcast. Woohoo! I've been talking about it for about a year and a half. I publicly said I was going to do it last summer, swore it would launch at the start of this year, but boom, here it is. Thanks for tuning in and checking it out. I'm Dr. Deborah Burton. I respond to lots of names. Deb, Debbie, Dr. Momma. That's my online personality that I created when I started my blog in 2016. I also respond to Dr. B. Dr. B is the name my hubby came up with when I opened a private practice, and in the office, when talking to the staff, he just decided that was the best name he could come up with for me. But for many, many years, I was simply known as Jasmine's mom or Courtney's mom. One of my best titles ever was Mom. Being a mom changed me. It forced me to evolve and think outside the box. The purpose of this intro episode is to give you just a little peek into my background so it can help you to understand my points of view and experience for making my comments. I like to talk. A lot. I have a lot to say because I'm old and have had a lot of experiences. I don't have a problem saying that I'm old. I know you're not supposed to say that, but the truth is the truth. So, first things first. Who am I? Well, I'm the youngest of 4 kids. I was born in Pittsfield, Massachusetts. I lived in upstate New York, but then we moved to Vermont. Being in Vermont helped to shape who I am and helped me to prepare to raise my girls. Why? My dad was a black engineer at General Electric. He was working in the 60s on the space race. Have any of you seen the movie Hidden Figures? Well, that was my dad. But except instead of being at IBM, he was at General Electric. I didn't know it at the time, but my dad was a badass. He was the only black engineer. We were the only black family in our small town, Shelburne, Vermont. We actually were featured in Ebony magazine because my dad was a black professional thriving in the small rural areas in Vermont. So let's let that wash over you for a minute. Being black and successful and a professional was a very unusual thing back in the 60s and the 70s. So that was my launching pad that, despite the odds, all things are possible. My mom? Well, she had a high school degree. She stayed at home until I went to kindergarten, and then she launched her career as a working mom, starting as a part-time sales clerk and ending up as a powerful manager at Sears and Roebuck. Think about that. Stayed at home, only had a high school education, and ended up as one of the most prominent managers in a successful retail chain. I had fabulous mentors. These 2 extraordinary people raised their 4 kids to be successful, competent, and fearless adults. They have both passed on, but every single day I feel their impact on me. And I use that to raise my own kids. When I was in middle school, my family moved to Maryland, where essentially I feel like I was raised in that state, even though I'm a New Englander for the early part of my life. After high school, I went to the University of Delaware, and there I met the love of my life, Clay. This year, we'll be married for 30 years. Hey, honey. Who am I kidding? He is not likely to be listening to my podcast. But I love him anyway. Clay and I are night and day, and that's what makes us a great couple in life and in parenthood. When we met, I was a type A ++++ personality, and he was maybe a type D-. I had never met anybody like that before. I was amazed at his ability to just let things happen and deal with it. While I played an elaborate game of chess, detailing every planned move, what outcomes I wanted, yeah, it was made for an interesting dating scene. But we made each other better. And after nearly 30 years, I can probably say that now my personality is probably a good type A, solid type A. And he is a really, really strong type C+. Clay's my backbone. He has unconditionally supported me in all my endeavors. He's the best life partner I could ask for. Together we raised 2 daughters, and we could not be more proud of them. The journey along this motherhood train is where I get all the years of experience that I'm going to be sharing with you. It's the backbone of the blog that I started, and it's the backbone of what I use when I talk to my parents every day in my private practice. So, besides being a wife and a mom, I'm obviously also a doctor. I attended Temple Medical School in Philadelphia, Pennsylvania. That's right, Philly, home of the newly crowned Super Bowl champions, the Philadelphia Eagles. Woohoo! No one saw that coming, did they? Full disclosure, I watch about 2 to 3 football games a year, always a playoff game or the Super Bowl. My hubby, on the other hand, he's from Delaware, lifelong Eagles fan, so this historic victory was awesome for him. All right, now back to my medical training. Medical school is expensive. And after a year of outrageous loans, I joined the Army so that I could get scholarship money to pay for my education. After graduation, I moved to Honolulu, Hawaii, where I did my internship at Tripler Army Medical Center. For those of you who've been to Hawaii, it's that big pink castle up on the hill. Amazing experiences there. I then moved back to Washington, D.C., where I performed my residency in otolaryngology. For those of you who don't know, otolaryngology is a fancy name, the official name for the specialty ear, nose, and throat, what most people say ENT. I am not quite sure why the entire world is comfortable calling their bone doctors orthopedic surgeons, their eye doctors ophthalmologists, yet they struggle to say otolaryngology. So we've settled in and understand who we are. I am forevermore known as ear, nose, and throat, or ENT. I accept that. Just sometimes I will throw out the big word otolaryngology just for fun, because it's on all my certificates, and it's fun to see, or imagine I can see, the puzzled faces every time I use that word. Anyway, after I finished my ENT residency, I moved to San Diego, California, where I underwent a year of fellowship training in pediatrics. So I became an expert on managing ear, nose, and throat problems in kids. After officially becoming that pediatric ENT surgeon, I moved to San Diego, Texas, where I served as the chief of pediatric ENT at the Brooke Army Medical Center. While working as a physician and training new ENT residents, this is where I had my 2 daughters. Thus began this journey that I had, learning how to manage a new career and learning to be a mom. To be sure, both of these tasks were difficult, but they got done. These past 25 years of experience, it's 26 years. I've been a mom 26 years. These years of motherhood are what I use to share the journey of motherhood and the tips that I'm going to share in my podcast as well as on my blog. After I finished my commitment to the Army, my family and I moved to Atlanta, Georgia, where I initially worked for a large ENT practice and eventually opened and ran my own solo practice, Atlanta Kids ENT. This can be found on the web, www.atlantakidsent.com. Being the boss and running my private practice, again, definitely hard work, but it also gave me the flexibility that I needed to attend school and extracurricular activities that my girls were involved in. So this is just a shout out to all the moms out there. It's good to be the boss. Put that on your to-do list. Own my own company. This was actually never on my list of things to do, but after it happened, I never looked back. I cannot imagine all these years of constantly asking for time off and explaining the need to arrive late or leave early just to say it again, being the boss is good. It's actually great. Right up there with fantastic. To this day, I still work full-time, evaluating patients in my office, performing surgery 2 different days each week. I have a highly experienced audiologist that works with me to perform hearing tests on children of all ages. The earlier hearing tests are performed, the earlier hearing loss can be found and treated, the better the outcome it is for kids to develop their speech and language. So this has been one of the hallmarks of my practice, and of course, I intend to have many, many discussions about hearing loss and speech delay. Over the past 10 years, I also built a thriving pediatric allergy practice, and I found my aggressive management of allergies has markedly reduced the need for my repeated surgeries in some of my patients. Allergy skin testing is done in my office. Both allergy shots and allergy drops are provided for long-term allergy management. Yes, you guessed it. There's also going to be many, many discussions about allergies, food allergies, pollens, other inhaled allergies, complications of allergies. Although being a solo private practitioner took a lot of time and work, I made sure to adjust my schedule to attend the events at school and sporting events. It became an art just to juggle my daily tasks. Swinging by the hospital to see patients before going to the office to evaluate and treat patients, as well as managing the office staff, running to the arts and crafts stores for the supplies for those seemingly never-ending school projects, making dinner, catching up on the events of the day, helping with homework, and again, more of those never-ending projects. It was a 3-ring circus, but one I wouldn't trade for the world. Many of my parenting tips that I will be sharing with Dr. Momma Says, the podcast, as well as my blog, are based on the methods I learned that helped me to juggle these duties. A big, big part of my success came from teaching my kids to help. Yes, it is perfectly okay for parents to get kids to help in all the activities that we do for them. Starting in preschool, I let my girls know that if they wanted to surprise me with special events, I can't go if you tell me at the last minute. They had to let me know in advance that, quote, something special was happening on Tuesday at 10 a.m. I didn't have to know what it was, but they learned that they needed to put it on my calendar. A lot of people underestimate what kids are able to do. I simply said, if you are making a little paper plate that you're going to hand out to your mom, you know you need your mom to be there, so you need to let me know. I clearly remember my oldest daughter not remembering to tell me. There was a Muffins for Mom Mother's Day program, midday, midweek. Well, I couldn't go. I found out at the last minute. But Super Dad Clay, he was able to juggle his schedule and he went. His face was priceless as he told me about wearing the cardboard sign with painted beans glued on it to spell out the word mom. There was wires and beads on it, and all the moms wore it proudly around their necks, and Clay wore mine. I was sad I couldn't go, but my daughter was also sad. Every teacher going forward used to mention at parent-teacher conferences that my daughters were both very aggressive about asking and knowing dates in advance if parents were invited to events. This was the beginning of my early mom experiences that showed kids are very teachable. If you set expectations, they will rise to meet them. The key is you have to have a better expectation for them, and then they can meet them. So my busy life as a working mom continued. Each day was packed. It was a whirlwind of precious milestones and memories. And then one day, those little girls graduated from high school. They both won scholarships to the Georgia Institute of Technology, also known as Georgia Tech. Go Jackets! Yep, very, very proud mama moments. After all of these years of channeling energy into a growing medical practice, accommodating all the needs of my girls, suddenly I found that empty nest was way too empty. Too many hours a day doing nothing. There just wasn't enough TV time to entertain me. On school breaks, my daughters would visit and would be overjoyed to suddenly see Netflix, Amazon Prime, the Fire Stick, and our cable channel all available to consume every possible show. When they were growing up, we didn't see that much. In fact, during the week, Monday through Thursday, there was no TV. So this whole debate about screen time, which I will have plenty to say about, it's not new. Kids have always loved the screen, and it just didn't happen. Again, my expectations were clear. There is no TV Monday through Thursday unless it's family TV. If the family was sitting around watching a TV, we could all watch it, but just not you mindlessly watching something to entertain yourself. So I recall my daughters would come in and say, "Don't you want to watch American Idol?" And I was like, "Not really," but their cute little faces. "You sure you don't want to watch TV?" So we would have some family TV time, but it is very doable. They do not have to have the screen time just because they want it. Well, anyway, back to my empty nest and all my extra time. I realized that just watching TV and having nothing to do after work wasn't going to be a sustainable solution for my time management. So that's when I decided to create a blog and share my parenting tips and advice for young moms who had no idea what was about to hit them. The blog was initially called Momma Addict, and it can still be found online at www.mommaaddict.com. MOMMAADDICT. That blog initially started off just to fill some hours each day with useful activities instead of watching movies. Eventually, I started sharing some healthcare tips, the same educational tips that I share every day in my private practice. Honestly, I was not prepared for the reception that I received from the moms who appreciated these tips. So after running the initial blog for a year, I then launched a new website that can be found at drmommasays.com. It also includes most of my old blog posts, but the site was rebranded to show that the content I'm creating is not just the mama addict, the mom who had become addicted to being a mom and was trying to find a way to fill her times. I have blossomed into Dr. Momma because I am forever a mom, reflecting on parenthood, but I am now a more confident person in my own path. My goal is to help parents of all stages of life understand their options. There is no one choice, but each choice comes with a set of pros and cons. It's also important to focus on self-care so you don't lose yourself in motherhood. And while focusing on keeping your kids healthy, you have to remember to keep yourself healthy. Finally, I'm also serving as a guide into the empty nest years. The healthcare tips provided in this podcast and on any future videos and on my blog are meant only for educational purposes. They should not be taken as medical advice. You should use this information to help you research more on the topic and have a discussion with this with your actual physicians. So there it is. I will be podcasting hopefully on a weekly basis, and I'll be sharing a wealth of information. But you know what? Life happens. It might not be weekly. It could be every other week. It could be twice a week. So how about you subscribe to the podcast and then be notified when I have new information to share? This is a long introduction. I doubt that all my future podcasts will be this long, but at least you want to know who I am and who this person is who's going to be sharing little topics. My goal is to share little bite-sized pieces on topics that you can digest, understand, and interact with. I would love to hear from you. You can email me, contact me, comment on any of my social media platforms. Over time, I plan to have interviews with healthcare professionals, parents, parenting experts, maybe even get my daughters in here to share, looking back on this journey, what things were good and bad, what suggestions from a child standpoint they might have. Hey, babies, shout out to you. Weren't expecting that, were you? So for now, this is it. I gotta go. But until the next time, this doctor is out. I truly want to thank you for spending your time listening to Dr. Momma Says. It means a lot to me because without you, there would be no podcast. If you enjoy what you heard today, please consider going to iTunes and giving me a 5-star rating. This will help me to gain the support that I need to continue bringing new and exciting content to you. To review any information presented in this episode, a summary of our show notes can be found on the web at www.drmommasays.com. And don't forget to subscribe to the podcast if you've not done so yet. Hope you come back and listen again soon.